advisor to Barack Obama, Peter Singer.
He's almost finished asking his question. Just wait there. We just got to listen to the rest of the question, please. Thank you, sir.
Thank you very much. We must ration health care. Why we must ration health care, saving the life of one teenager is equivalent to saving the lives of 14 85-year-olds. That is a friend and advisor to President Barack Obama, who said, I will read you this, those that I associate myself with those who have shaped my ideas, and I will be surrounding myself in the White House. Thank you. You've been talking about the union. I was a union representative, union steward for 4 years with Kraft Oscar Mayer in Davenport, Iowa. In 2000, during the Gore-Bush election, I was at a meeting with over 200 other union stewards, Jerry Lesser, the president of the union, John Honeycutt, president of the local, and our chief steward and business operator were all present at this meeting. They told us then, and I heard this with my own ears, as soon as we get Al Gore elected and national health care adopted, we can take health care as a benefit to all members off the negotiation table when we negotiate new contracts. Then we can possibly get more money for or other benefits such as
question.
Child health care or child care for in 2004 in the Kerry Bush election.
We don't have time for paranoia. Let's go to the next question. Do you have a question, Randall? Go ahead.
My question is, sir, if the unions are going to take in this country negotiation of healthcare negotiations off the bargaining table in their contracts, and all of these people go on national health care rolls, how are we going to pay that much money?
Many of his comments and stuff I can. I'll take just a second. But the last point first. I think it would be wonderful if we had a system whereby you as an individual could choose what your health care is going to be instead of having that be part of an ongoing negotiating process. Again, the last part of what you said, I will respectfully disagree with your kind of assumption that everybody will go on to a government plan. I've already mentioned the statistics that the CEO sent out. 12 million maximum by 2019. So again, I think we have to be careful when we're talking about this bill, what's going to happen, I know there are a lot of fears, a lot of concerns. A lot of people are worried that it's going to lead to this or lead to that, but it's simply not the case when it comes to where those folks are going to go. They're going to make that choice. No one can be dumped, told, whatever, where they're going to be going as far as their health insurance is concerned. Now, the advisors, if I could just answer this, man, the advisors, Ezekiel Emanuel. By the way, most of you know Ron Emanuel better than you know his brother Ezekiel, right? And Ron is the chief of staff for the president. But I've been in meetings with Ezekiel. Again, I'm not going to speak for Ezekiel. His writings are his writings and all the rest. All I can tell you is what is in here. The American Medical Association has stated unequivocally that this will not lead to rationing. They have No, I don't understand. People think that, you know, they fear, they suspect that this may lead to rationing. I'm not going to vote for anything along the lines of what you're talking about, man. I'm not going to vote for anything that is going to lead, I promise, it's going to lead to rationing, it's going to lead to euthanasia, it's going to lead to people, faceless bureaucrats making decisions for your family, for your grandmother, for you, whatever. That's not what's in here. And I'm not going to vote for anything like that because it's not going to sign anything like that.
We really appreciate everyone coming. We know there's a lot of questions that we didn't get to today. So next month we're going to be having a telephone town hall meeting, and we'll get that information to you or call our office, or hopefully we'll get it out in the press as well for opportunities for that. Our last question is going to come from Stephen up in the balcony. Stephen?
Bobby Paxton.
Congressman Loebsack, I've been a frequent letter writer to you and have appreciated all your replies. My question had to do with end-of-life care. It had to do with addressing how hospice plays into all of this and how beneficial that is and how cost-effective that is. And we just found out, I volunteer here in Iowa City, at Iowa City Hospice, that in 2008, legislation was signed by President Bush to cut reimbursement to hospice, one of the most effective organizations anywhere. Thank you. Our work is done primarily by volunteers, and as an RN, I have seen the best and the worst of end-of-life care. And I'm here to tell you that what I am privileged to do with hospice patients is far, far, far more compassionate to the family and to the patient than anything that happens in an ICU anywhere.
But I should just say that, since I've been in office about 2.5 years or so, I think that as a profession, we need to document this for sure, but my impression is that as a profession, I have met with more folks in the healthcare profession than I have any other group in DC and here. And I've been to every hospital in the district. I've been to many of the clinics. I've talked to palliative care folks, hospice care folks, who say exactly that. There's no doubt about it. That's why I think end-of-life decisions, and as Senator Grassley himself said, 20 years before you reach that stage, it would be ideal to be talking about these things. Living wills are really a good idea, right? And that's why in this bill, the idea of Medicare reimbursement for, again, as I said, a consultation on the part of a provider, an expert medical provider. I think it's so critical so that folks know what their options are later in life. Even if it's later in life when they begin to know what those options are, and that their families know what those options are. Everyone I've talked to has said it's absolutely critical. And keep in mind that provision on the Senate side was introduced initially by Senator Johnny Isaacson, a Republican from Georgia. It was only after all the scare that was going on and misinterpretation, I think misinformation about that provision, that a number of folks withdrew their support for it. Again, I think that's really unfortunate. I think it's going to do a tremendous disservice if it's not in here, not only to those older Americans, and keep in mind, Iowa, we demographically are one of the oldest states in America. We, as a percent of our population, 85 and over, we are the highest. We're among the highest, 75 and over. This is so critical for Iowa. I don't want to take that opportunity away from those individuals and those families to get all the information they possibly can.